Ricky, when I catch you, Ricky, Ricky, when I catch you, Ricky, Ricky, when I...
So you had an allergic reaction and now you're frantically looking at all the ingredients of your foods to figure out what caused the reaction. Hey, I'm Dr. Imam, I'm a board certified allergist, and I'll talk to you what I see most commonly when it comes to this. It's really annoying to figure out your triggers. I mean, those foods have like 500 ingredients. Alright, so number one is you actually had an allergic reaction to the food. The nature of the allergic reaction might be helpful to the allergist. If it's just kind of swelling of the lips or itching of the mouth, then fresh fruits and vegetables become more suspicious and oral allergy syndrome becomes a possibility. If it was a full-blown anaphylactic reaction requiring epinephrine, then we start looking more closely at the 9 major food groups and then possibly alpha-gal if you're in Texas or a place with the Lone Star tick. The history of the person is also useful. Anybody can get a food allergy, but if a person has a history of asthma, allergic rhinitis, and eczema, a food allergy becomes more likely. If it's the first time a person has a reaction and they're like 35 years old and they never had an allergy before in their life to anything, then a food allergy just becomes a little less likely. Okay, reason number 2 is you probably just ate a food that you were always allergic to. You just lowered the threshold for the reaction, so you unmasked the reaction this time. I had a case of this like 2 days ago. Gentleman nibbles on shrimp here and there, never really had a reaction. But then goes to a party, has a lot of alcohol, eats a lot of shrimp, then goes dancing, breaks out in a reaction about an hour later. The alcohol and the dancing, that increased the absorption of the shrimp, and the quantity of the protein actually elicited the response. So when we tested them, they were positive to shrimp. Okay, lastly, you didn't have an allergic reaction to a food. Lots of things can cause reactions like hives. A virus can cause hives. It could be the first manifestation of chronic spontaneous urticaria. Heavy exposures to inhalant allergens like dust mites in your pillow or a new cat can cause hives at times. So this is where the history is really important. Somebody's saying I was eating dinner and then halfway through dinner, 20 minutes in, I started vomiting and having diarrhea and broke on hives and couldn't breathe. Really suspicious for a food allergy. If somebody's saying my eczema's flaring or I had some minor itching on my skin, that could be many things, not just necessarily a food. So if you had a reaction, get a food diary, go see an allergist, and don't drive yourself crazy reading the ingredients. Hope that helps.